Sometimes there is a big difference, a big gap between what a patient wants from a hair transplant and what can be delivered, especially in higher grades of baldness above grade 5. But in some cases, there are strategies to bridge this gap, and they are tailored to each patient, depending upon their requirement, depending upon their objectives, and depending upon variables that exist in the donor area and the recipient area. So in this video, I'm going to deal with all these strategies and especially focusing on an analysis of color differential and the leverage that it gives in better hair transplant outcomes in select cases. So hold on. So here's a very quick view of the strategies that can be adopted in difficult situations. Number one, when the donor area is vast and graft availability is not in keeping with this area, a procedure for greater grades of baldness can be staggered over 2 to 3 procedures. Number two, using body grafts in greater numbers when available. Number three, using scalp micropigmentation as an adjunctive treatment to create an illusion of fullness in a shaven head, along with a low density hair transplant using the FUE technique. Using a hair patch for the crown and concentrating all your efforts, all your resources in the frontal region, the hairline, the mid-scalp and the temple points. Gradual decrease in density with preferential graft placement. And lastly, and the topic for the day, using fewer grafts to create an illusion of fullness in a patient with lower skin hair contrast.
ਉਹ ਚੱਕਾ ਰਾਹ 'ਚ ਜਾਂਦੀ ਇੱਕ ਜਨਾਨੀ ਦੀ ਚੈਨ ਖੋ ਕੇ ਭੱਜ ਗਿਆ। ਪੁਲਿਸ ਨੇ ਵੇਖ ਲਿਆ, ਜੀਪ ਪਿੱਛੇ ਲਾ ਲਈ ਉਹਨਾਂ ਨੇ। ਬੰਦਾ ਭੱਜਦਾ ਭੱਜਦਾ ਇੱਕ ਕੋਠੀ 'ਚ ਵੜ ਗਿਆ। ਪੁਲਿਸ ਵੀ ਪਿੱਛੇ ਪਿੱਛੇ। ਬੰਦਾ ਬੈਡਰੂਮ 'ਚ ਗਿਆ, ਉਹਨੇ ਵੇਖਿਆ ਕਿ ਇੱਕ ਜਵਾਕ ਸੁੱਤਾ ਪਿਆ ਤੇ ਉਹਦੀ ਦੁੱਧ ਦੀ ਬੋਤਲ ਪਈ ਹੈ ਨਾਲ। ਬੰਦੇ ਨੇ ਦੁੱਧ ਵਾਲੀ ਬੋਤਲ ਚੱਕੀ, ਆਪਦੇ ਮੂੰਹ ਨੂੰ ਲਾ ਕੇ ਪੈ ਗਿਆ ਤਾਂ ਕਿ ਪੁਲਿਸ ਨੂੰ ਭੁਲੇਖਾ ਪਵੇ ਕਿ ਇਹ ਵੀ ਕੋਈ ਜਵਾਕ ਸੁੱਤਾ ਪਿਆ। ਪੁਲਿਸ ਆਈ ਬੈਡਰੂਮ 'ਚ, ਉਹਨਾਂ ਨੇ ਦੇਖਿਆ ਕਿ ਐਡਾ ਵੱਡਾ ਜਵਾਕ। ਉਹਨਾਂ ਨੇ ਕੰਬਲ ਲਾਇਆ, ਹੇਠਾਂ ਬੰਦਾ ਦੁੱਧ ਵਾਲੀ ਬੋਤਲ ਮੂੰਹ ਨੂੰ ਲਾਈ ਬੈਠਾ। ਪੁਲਿਸ ਵਾਲੇ ਕਹਿੰਦੇ, ਓਏ ਆ ਕੀ ਕਰੀ ਜਾਂਦਾ? ਬੰਦਾ ਕਹਿੰਦਾ, ਕੁਛ ਨਹੀਂ ਜੀ, ਦੁੱਧ ਪੀਂਦਾ ਹੈ। ਪੁਲਿਸ ਵਾਲੇ ਕਹਿੰਦੇ, ਛੇਤੀ ਪੀ ਲੈ, ਇਹ ਤੋਂ ਬਾਅਦ ਆਪਾਂ ਤੈਨੂੰ ਪੀ ਤੇ ਘੁਮਾਉਣ ਵੀ ਲੈ ਜਾਣਾ ਹੈ।
So today let's focus on this point. Though this may not be applicable to everybody, it is applicable to the lighter races like the Caucasians and patients who have albino effect, leveraging to our advantage the color contrast between the skin and the hair. This concept, when combined with an understanding of other hair characteristics like curly wavy hair, allows for a personalized approach to each patient's unique situation. This principle of skin hair contrast can create effectively an illusion of fullness, an illusion of higher density, even in cases of advanced baldness. Skin hair contrast refers to the difference in color between the recipient skin and the hair shaft. A high contrast like dark hair on a light scalp makes gaps between individual planted hair quite glaring. And as we know, a hair transplant is not 100% natural density. At most, we can achieve densities of 50 to 55 per centimeter square. So to know this limitation is very important in hair transplant procedures. On the other hand, a low contrast, that is light hair in a patient with a lighter complexion or dark hair in a patient with darker complexions, masks these gaps effectively, making the hair transplant outcome look denser. So it is obvious that when the skin hair contrast is low, fewer grafts are needed to achieve the same amount of fullness which otherwise would have been required. This natural blending effect of similar colors makes the scalp look less visible even when the hair is not densely packed. It's like a painter using shading techniques to give the illusion of depth on a flat canvas. By strategically placing grafts to maximize perceived density, we can achieve higher densities with fewer grafts. This not only saves the patient's scalp donor, but also saves in the cost of hair transplant. And both of them are limited resources. And as I said, this method is more useful for patients with higher grades of baldness. In patients with lower grades of baldness, who are not young in age, the baldness is not progressive, there is no point utilizing this concept. In higher grades of baldness, when the entire scalp needs to be covered according to the patient's objectives, creating an illusion of fullness with lesser grafts available means that the grafts can be spread over larger area even with lower density and still achieving a natural, satisfactory appearance, the appearance the patient would like. And this is a classic case of less is more. Less is more in hair transplant. When careful planning and economical use of available resources yields superior outcomes. As an additional benefit, the procedure is less invasive. You get lesser downtime because less number of grafts have been done. Healing is faster and better, and the scarring is less. And we are conserving grafts for future use because your donor area is not limitless. So as the baldness progresses in future, we have quite a few grafts left, even in the scalp, to cater for further advancing baldness. And patients are more satisfied when they see that lesser number of grafts have been utilized for a large area with good results. And this adds value to the procedure, which the patient appreciates. While skin-hair contrast is important, there are other characteristics of hair like waviness, curliness, texture and thickness that play crucial roles in achieving hair transplant outcomes. Curly or wavy hair provides better coverage than straight hair, and thicker hair shafts cover the scalp more effectively than thinner ones. This is common sense. Even with these variables, the principle remains that lower skin-hair contrast can reduce the number of grafts that we need to harvest. Success lies in the strategic placement of these grafts. Surgeons must carefully plan the distribution of these grafts to obtain a natural hairline and a natural density pattern, considering the direction and angle of hair growth to ensure a seamless blend with existing hair. And this mimicking of natural growth patterns creates a harmonious and aesthetically pleasing look. In summary, understanding and applying the principle of skin-hair contrast allows hair transplant surgeons to achieve impressive results in a background of the challenge of extensive grades of baldness like grade 6 and grade 7. This approach not only conserves valuable hair, but also enhances patient satisfaction and, of course, patient trust in the clinic. This synergy of art, scientific discipline, skills, and experience underscores the sophistication and precision required in today's modern hair transplants, ultimately delivering results that are aesthetically pleasing and practically beneficial to the patient. Thank you for watching. If you have any questions about hair transplants, about hair loss treatment in men and women, or you're seeking a hair transplant in India, please let me know. Leave a comment in the comment section below and I'll get back to you at the soonest. Have a nice day and God bless you.
ਤੁਹਾਨੂੰ ਇੱਕ ਜ਼ਿੰਦਗੀ ਦੀ ਸੱਚਾਈ ਦੱਸਣ ਲੱਗੇ। ਤੁਹਾਨੂੰ ਸਾਰਿਆਂ ਨੂੰ ਆਪਦੇ ਜਿਹੜੇ ਰਿਸ਼ਤੇਦਾਰ ਬਹੁਤ ਖੁਸ਼ ਦਿਖਦੇ ਨੇ ਨਾ, ਕਦੇ ਇਹਨਾਂ ਤੋਂ 5-10 ਹਜ਼ਾਰ ਉਧਾਰ ਮੰਗ ਕੇ ਵੇਖਿਓ, ਇਹਨਾਂ ਦੇ ਸਾਰੇ ਦੁੱਖ ਸਾਹਮਣੇ ਆ ਜਾਣੇ ਆ। ਮੰਮੀ ਦੀ ਲੱਤ ਟੁੱਟ ਗਈ ਸੀ, ਉਹ ਤੇ ਬਹੁਤ ਪੈਸਾ ਲੱਗ ਗਿਆ। ਲੈਂਟਰ ਚੋਈ ਜਾਂਦਾ, ਅੱਜ ਤੱਕ ਠੀਕ ਨਹੀਂ ਹੋਇਆ। ਜਵਾਬ ਦੀ 3 ਮਹੀਨੇ ਦੀ ਫੀਸ ਪੈਂਡਿੰਗ ਹੈ। ਪਿਛਲੇ ਮਹੀਨੇ ਨਸ ਚੜ ਗਈ ਸੀ, ਕੰਮ ਤੇ ਨਹੀਂ ਗਿਆ। ਗੱਡੀ ਵੱਜੀ ਸੀ 2 ਸਾਲ ਪਹਿਲਾਂ, ਅੱਜ ਤੱਕ ਨਹੀਂ ਠੀਕ ਹੋਈ, ਲੰਗੜੀ ਚੱਲਦੀ ਹੈ। ਭੋਲਾ ਪੈਸੇ ਮੰਗ ਗਿਆ ਸੀ, ਅੱਜ ਤੱਕ ਨਹੀਂ ਮੋੜ ਕੇ ਗਿਆ।